Okay, is that good? Can you hear me? Great. Well, thanks again for coming. Again, I'm Katherine Restrepo. I'm the Director of Healthcare Policy here at the John Locke Foundation, and I'm really pleased that this is a packed house because telemedicine is it's an innovative solution to this rural gaps in accessing healthcare across the state. As Donna mentioned, there's over 145 primary care shortage areas in North Carolina. And this is not just a state-specific issue, but it's really an issue on the national level. I mean, 20% of Americans are living in rural areas, and just 11% of our nation's primary care doctors are practicing rural medicine. And this map just gives you sort of a snapshot of the rural landscape across the United States. And this is provided by the Kaiser Family Foundation, and this again shows primary care shortage areas in each state. So the darker blue shaded states, the more severe of a problem it is. And I'd also just like to mention that even for people who have insurance, the nation's dialogue talks a lot about reducing the number of uninsured people and promoting more people to have coverage. But coverage doesn't necessarily mean that you have good access to health care as well. So, I think telemedicine, whether insurance companies cover it or not, it's proving that basic primary care can be affordable when it's paid for out of pocket. And I'll get into that in a little bit. And when we think about what rural is, it's not really a concrete, black and white issue when we're talking about this rural-urban divide with healthcare access. And in fact, I was at a committee meeting a couple of weeks ago, earlier this month, and an expert was brought in to talk to legislators who have actually convened, and they have established the Committee on Accessing Rural Health Care in North Carolina. So I really just want to thank all those legislators who are really honing in on this issue. Not that this is the first time that they've been talking about this issue, but the expert that was brought in, Mark Holmes, he's with the UNC Shep Center at the University of North Carolina. I thought this was so interesting. Rural isn't black and white, so to speak, but it's kind of a continuum. So there's different types of rural areas. And in fact, the federal government defines rural 17 different ways. I'm not really surprised that the federal government defines it 17 different ways. But in other words, so the darker green shaded regions share more rural definitions as defined by the state and federal government. So imagine that you're a patient living in one of those regions, and say you have Parkinsons. It's a really nationwide shortage right now with neurologists, and you need to be seen, or you want to see a neurologist for a certain prescription medication for your Parkinsons, but the closest one is 200 miles away, and this really is not an uncommon situation. But thankfully, with telemedicine, you can go to your primary care doctor. Your primary care doctor has access to online specialty consultations. They can consult with a neurologist, maybe on behalf of a prescription medication that you're on. And instead of having to travel all that way, this is saving patients time and money. They have better access. They can stay closer to their communities. So, telemedicine, what it is, put simply, it's delivering healthcare from a distance. There's 3 different types of telemedicine. You have virtual telemedicine, so you can have a 2-way consultation, live consultation, interactive consultation with a doctor. There's lots of direct-to-consumer companies out there providing the services. Teladoc, MD Live are just a few of the leading competitors in that industry. And then you have store and forward, which is also known as asynchronous medicine. And for as much hype as virtual online consultations get, I think that the beauty of asynchronous telemedicine is that it's so efficient for the patient and the doctor, and especially for non-urgent needs. Say that there's a rash that you're not really sure about, you can take a picture of it, send it to your doctor can evaluate it later, and in the meantime they can see more complex patients or more urgent needs in their office. So again, it's so convenient for the patient and the physician as well. And also with asynchronous telemedicine, when you have, a lot of times there are these secure messaging platforms. Spruce Health is one company that offers this type of service. And all of that documentation, that correspondence between the doctor and the patient, that can be uploaded in the patient's electronic medical record. So there's better documentation, and that studies have shown that it's better than verbal, verbal communication between the doctor and patient, because a lot of people, studies have shown that when people exit the exam room or the doctor's office, they forget half the time or incorrectly remember what they're supposed to be doing. So this, again, can lead to better medication and patient adherence. And then lastly, there's remote patient monitoring. A lot of hospital systems, Carolinas Medical Center is a big player in this, and they've been implementing telemedicine initiatives where you have tele-ICU units. So you can, Carolinas Healthcare, not too long ago, they established this command center in Mint Hill outside of Charlotte. And they staff it with specialists, intensivists, and nurses, and they're able to remotely monitor patients who are in different ICU facilities across 10 different locations. That's all part of Carolina's healthcare system. So you have this extra set of eyes and ears managing patients' health needs that are the most critically ill patients, and it's very expensive. I mean, 30% of hospital costs typically goes to ICU units. And I mean, these programs have paid for themselves. I mean, the return on investment has been as low as soon as 9 months to a year. And I'll get more into that in a little bit. So I think it's interesting. I always like looking at the history of innovation here. So let's go back in time a little bit and look at the telemedicine history. And it really started with the invention of the telephone in the 1870s. So not too long after, I found this was fascinating that the Lancet Medical Journal is one of the nation's oldest medical journals. And it already had reports, articles of how doctors are using the telephone to reduce unnecessary house visits. And then in 1924, Radio News Magazine, which is this picture right here, and as I was kind of researching the history of telemedicine, this was really a picture that I come across so much. So I'd say this is really like an iconic piece of the history of telemedicine, or an iconic picture. And that is the editor of the Radio News Magazine predicted that one day, patients could have this audio-visual interaction with their doctor. So here you can see the patient looking into a television screen, with audio devices as well to have that interactive engagement with a doctor. And then in the mid-1900s, radiologists and psychiatrists were really among the first specialties to embrace telemedicine, which makes sense because with radiologists you could transmit and forward images of x-rays with other physicians to consult on behalf of a patient. And then in the 1990s with the internet, I mean, that's really when this industry just began to boom. So here we are today. And these are just a few of the companies out there. A lot of them, again, are direct-to-consumer companies where you can have that virtual online visit for as low as $50 out of pocket. And it's really saving patients money because, it's redirecting them from waiting in an urgent care. I mean, you can connect to a doctor within minutes through these companies. It's saving patients from going to an urgent care or from an unnecessary trip to the emergency room. And we all know that there are so many instances where patients end up going to the emergency room, even if they have insurance, simply because they cannot access a primary care physician in a timely way. And there's so many other players, besides it being really entrepreneurial. I mean, insurance companies are offering telemedicine benefits. I'm glad to see that some insurance representatives are here today. They've been offering telemedicine benefits to their policyholders since the 1990s for mental health needs, for diabetic counseling, for nutritional services. United Health 3 years ago in 2015 started offering patients virtual, partnering with a vendor to offer their policyholders virtual visits. And it's insurance companies, large employers. The Wall Street Journal had this great article about the innovation of telemedicine, and a survey amongst the largest employers said that in 2017, or within 1 year, up to 75% of large employers are now offering this benefit to their employees. So it's really, it's saving time, it's cutting down on lost work productivity, it's just improving access to care, and especially in rural areas. So speaking of in rural areas. So I want to show you, I want to hone in on this one company. This is RelyMD, and this is a homegrown telemedicine company. It was started by a group of emergency physicians in North Carolina in 2015, and they provide virtual consultations with patients. So you can connect to a doctor within 10 minutes, and they can help you with an array of ailments. And I just want to show you, I just want to play you this video just to give you an idea of how they operate here.
Hi, I'm Dr. Seth Blyer, a physician with RelyMD. It's nice to meet you. How can I help you today?
I've been having these symptoms for about a week now. At first I thought it was a cold or some kind of virus, and I've just been so busy that I haven't been able to get in to the doctor.
Hi, I'm Dr. Kim Singletary. How are you doing today?
Well, I play tennis 3 or 4 times a week, and I've never had much of a problem, but there's been a persistent ache in my shoulder down to my elbow, and it didn't get real bad till 2 a.m. and anytime I rolled over, it brought tears to my eyes almost.
So I picked my son up from school, and the moment we got home, we were packing up to head to the mountains for the weekend, and we were about to walk out the door, and he said, "I'm itchy." And I looked down, and he's covered in hives. I called urgent care. They said there was a 1-hour wait, so I called RelyMD and was able to get on within 10 minutes.
Getting online with a physician who you may or may not have seen before is a little bit unnerving. So once you get on there, you start having the first few minutes of getting to know one another, and you're answering questions. It becomes very natural, and at the end, almost every single person who has used it for the first time says that was so easy, so convenient, and it basically allayed all their fears.
It was really easy. Dr. Park was super friendly and was able to talk him through what he needed to do in terms of showing him his hives and checking out his throat, so that it was an easy experience.
Based upon your examination and your symptoms, it does seem like it's most consistent with sinusitis.
It's very similar to what you might expect at a doctor's office or even urgent care now. It's a little bit different in the sense that you're going to be, talking to your tablet or your phone or maybe a computer, and that the person that you're interacting with isn't right there next to you. One of the things about telemedicine that I think is really helpful and unique is that it's more of a collaborative type of evaluation.
And it may be that we will have the patient walk across the room or sit down in a chair and stand up and do certain exercises that we would do with them if they were standing in front of us.
And then once we get a good sense of what's going on, if you need it, we'll call in a prescription to your preferred pharmacy. That's done through an e-prescribe system. It's very quick and convenient. And I would say usually it takes all of anywhere between 15 to 20 minutes from start to finish.
Name of your local pharmacy and the address, and I'll be happy to call in the prescription so that it's waiting for you when you arrive.
That I didn't have to actually wait in town to work with my local pharmacy. Dr. Park was able to call the prescription in the place that we were going. It was a 3-hour drive that I was about to get on the road, and he just made a phone call, and so by the time we got into town, the prescription was waiting for us.
We're North Carolina doctors taking care of North Carolina patients, and that's something that we're proud of.
I like that people can continue going about their daily business or stay at home at night and have the satisfaction of knowing that their loved one or they themselves are going to be okay.
What I was hoping for was to make sure that we weren't facing something serious, but do so in a way that was fast and convenient, and in the case that it wasn't serious, that we could get on with our weekend.
Okay, so that's just a little bit about what RelyMD is all about. And as far as extending access to more patients, specifically in rural areas, in 2016, RelyMD partnered with a community health center in Burlington, North Carolina, to extend after-hours care to all those community health center patients. And that partnership was really successful, so then the next year they expanded their partnership to all of Piedmont Health's community centers. And I mean, so when you think about it, that's really significant because they're offering after-hours care to 42,000 patients who belong to community health centers in the Piedmont region. So this is with between 8 to 10 different locations. And we're talking about Caswell County, Lee County, Person, Randolph counties. These are rural areas where it may take a bit more time to access someone who, when a community health center is closed at that time. Moving on to asynchronous telemedicine, this is probably one of my favorite examples I like to talk about. But it's also, telemedicine is helping patients in rural areas also get quicker access to specialists while remaining in a primary care setting. So with Rubicon MD, doctors can subscribe to this telehealth platform for $250 a month. and they have access to over 100 different specialties. So they can talk to endocrinologists, they can talk to dermatologists, they can talk to orthopedic surgeons on behalf of managing their patients' care. And so it works where a doctor submits a question on the platform if they're really not sure, if something's out of the scope of their practice, and then there's an assigned specialist that takes that inquiry, responds to that doctor within hours. And I want to show you a quick video here of how this has saved one patient. This is a doctor using Rubicon MD out in Kansas, a rural area in Kansas, and he was able to save his patient's life and thousands of dollars from having to see a specialist because he was able to remove a basal cell carcinoma himself, and he was received guidance from a specialist to do so.
My name is Dr. Vance Lassie. I am a family physician. I specialize in direct primary care, and I use Rubicon MD specialty e-consults. Diane came to us. She had a large basal cell carcinoma, huge cancer on the side of her nose.
I was not financially secure enough to go to like a dermatologist and have it removed. People never saw me, they only saw it. I came in and saw Dr. Lassie. He discussed with me what it was.
It's the kind of thing I take off all the time, but in this area on the nose and being that big, it's just beyond the scope of my traditional practice with that kind of lesion. With Rubicon MD, I was able to quickly put a consult in. Within 12 hours, I was corresponding back and forth with a specialty, in this case, what they call a Mohs surgeon, a dermatologist that's trained in a special type of plastic surgery. They kind of walked me through what I needed to do. I don't think I would have done the procedure I did on Diane if I didn't have Rubicon MD, because I just don't know that this is a procedure I would have been comfortable with without the specialist who really specializes in this area coaching me through it. It went great because of that. She had a great outcome and saved thousands of dollars.
Very few people noticed that I had the surgery done because it was done well enough that it's not noticeable. Dr. Lassie gave me my face back.
This specific doctor, Dr. Vance Lassie, I do communicate with him from time to time because he's a direct primary care doctor. And these doctors, if you're not familiar with that practice model, they do not take insurance whatsoever. So in exchange for a $50 monthly fee, that patient has all of their primary care needs can be taken care of by that doctor. They can schedule same-day appointments. They can see the doctor whenever they want. And again, telemedicine, when we're incorporating telemedicine, it pairs so well with direct primary care, with that practice model, because some doctors are hesitant to use telemedicine because they may not be reimbursed for certain things right now, but these doctors, they're totally bypassing the complexities of insurance and billing codes, and they're just able to be innovative, even so much more innovative, by incorporating telemedicine into their practice model. And as he's using Rubicon MD, he doesn't pass any additional costs onto his patients for that service. So that patient still only pays $50 a month, and they have access to e-consult specialty services as well, which I think is really amazing. And then lastly, telemedicine is also being used within a remote patient monitoring setting. So as I mentioned earlier, Carolina's healthcare system, they have that command center in Mint Hill, and they're able to monitor ICU patients in 10 different locations. That's all part of the healthcare system. One of them is in Lincolnton, North Carolina, which again is a rural area. And again, it's this extra set of eyes and ears where specialists from a distance can monitor patients, their labs, their vital signs. They can catch anything that's a small problem before it becomes a larger problem. And it really influences that team-based care, that collaborative care too, because they're able to work with the nurses at the bedside who are working with those patients. And it's saved large hospital systems lots of money, because over time there have been studies that have starting to come out where it's reduced average length of stay, it's reduced mortality rates, and it's able to, these hospitals are able to see more patients that way. And it's also good for the rural communities because you have healthcare providers who can stay. There's job retention in rural communities. They can stay, they can take care of those patients, so it's good for the rural economy as well. So there's tele-ICU services. And there's also a lot of, there's more of an uptake with telestroke interventions. A lot of rural emergency departments and rural hospitals are struggling to recruit certain specialists like neurologists. So if a patient presents themselves in a rural emergency department and there's no neurologist available, or they have to, instead of having to be transported to an academic medical center or a larger regional hospital, these physicians at emergency departments are using telestroke services where they can video in with a neurologist elsewhere, and that neurologist can coach that physician to administer clot-busting drugs. I mean, when we're talking about presenting with stroke-like symptoms, I mean, time is everything. And experts will say, I have often come across with this in my research, is that they say time is brain, because you only have 3 to 4 hours of time to assess and stabilize that patient, or else there's just such a higher likelihood of that patient having severe disability, long-term disability, or even suffering from death. So telestroke interventions, the literature, the lit reviews on that have shown that, just patients have access to a neurologist in half the amount of time as compared to hospitals that do not have these types of telemedicine initiatives that have been installed. So when it comes to policy recommendations, and I really hope that we can have more of a discussion about this in the Q&A, but there's lots of policy recommendations on how to expand telemedicine's reach to more patients. There's lots. But what I think lawmakers can focus on, and they've done a good job already in some cases with reducing licensure barriers, is to further reduce licensure barriers at an intrastate and interstate level, so across state borders and within the state. For example, North Carolina, in 2014, it used to be the case that for telemedicine, you have to have an in-person visit first before, when you establish a physician-patient relationship, before you can use telemedicine with that physician. Well, right now, the medical board changed that in 2014, so you can establish a relationship with a physician through telemedicine, through your initial encounter. Also, in 2017, Governor Roy Cooper signed off on the interstate the nursing licensure compact. So nurses in North Carolina, they can have access, they can gain a multi-state license, and they can practice, they can help patients, they can care for patients in multiple states, including North Carolina, any of those states that are part of that nursing compact, inclusive of telemedicine. There is the interstate medical licensure compact, where doctors have access to more of a streamlined service or a streamlined process where they can gain multiple licenses in different states, again, that are part of that compact. This is through the Federation of State Medical Boards that was designed by. It's definitely an option that North Carolina can pursue as legislation to sign onto the compact. However, I think that it's streamlined in the sense that you don't have to wait for approval from another state to be licensed in that state to sign up for another state if you want to practice medicine, inclusive of telemedicine in that state. But when it comes to licensure, there's all these fees and renewal fees, and that adds to the cost of care. So I think an even simpler solution would to have a mutual agreement. If North Carolina would have a mutual agreement with other states, say surrounding states, say North Carolina or South Carolina or Virginia, have a mutual agreement where doctors in Virginia can go through certification process or something to offer telemedicine services to patients in North Carolina and vice versa. That would create for a more competitive market, reduce the artificial prices of healthcare, because there aren't, there's not as much of a barrier there. That's another option. And then another option that's been proposed is for Congress to redefine the location of telemedicine. Because right now, as it's defined, telemedicine depends on where the patient is, not where the doctor is. So that's why typically North Carolina, if you have a medical license, you can only take care of patients in North Carolina. So by transitioning that definition from where the patient is located to where the doctor is located, it really would obviate the need for all of these licensure compacts. And then doctors, that payment is then tied to the doctor, not to where the patient is, and then doctors can practice medicine all across the country. So again, that would make for a more competitive environment as well, and provide patients way more choices. They would have so many more options to choose from when it comes to accessing specialists or primary care doctors. So those are just a few options, but I'd be happy to talk about any others. I know that in 2016, Florida tried to have developed this out-of-state registry where they would allow for out-of-state providers to offer telemedicine to Floridians. That bill passed in the House, it failed in the Senate, but that could very well come up again in future sessions. So I'd be happy to take any questions. Thank you.